One of the things that I think has become even more important as myeloma patients are living longer is trying to understand how to optimally support them during their therapy and prevent the emergence of long-term adverse events. And probably the two or three that are most important are peripheral neuropathy is probably the biggest one. We now know we make dose adjustments and dose modifications earlier in the course of therapy. Patients that are on, for instance, IMiD maintenance for a longer time now, 2 years, 3 years, 5 years, we're starting to see the emergence of some mild grade 1 peripheral neuropathy in those patients as well. And so just making sure you're paying attention to those kinds of events and adjusting the dose of medications if needed, I think is actually really important. The other area that's probably growing relatively rapidly is bone health. We've known that bisphosphonates like zoledronic acid and pamidronate have been very active at preventing skeletal events. We also know that the proteasome inhibitors, bortezomib and carfilzomib and ixazomib, all actually protect bone and actually help to rebuild bone. But there is now data on the use of the rank ligand inhibitor denosumab, which seems to be somewhat similar in terms of its ability to prevent skeletal-related events, but may actually be safer to use in patients with renal insufficiency, a big issue among myeloma patients. And so I think emerging focus on bone and bone protection is another area where I think we need to pay a lot more attention. For this specific patient, I think there are two areas worth focusing on. The first is the significant amount of back pain and bone pain associated with the compression fractures. And this is somebody very actively that we would try and obtain something like kyphoplasty or vertebroplasty for to see if we could rapidly alleviate some of their symptoms. The use of dexamethasone should actually help with pain relief as well. The use of bortezomib will actually help with pain relief, particularly in bone lesions. That will be helpful as well. And of course, supportive therapy such as zoledronic acid or pamidronate would be also indicated in this patient. Now, because of his renal insufficiency, he's got a creatinine clearance of about 32. This actually may be a patient where the use of denosumab might be an important approach, given that bisphosphonates do have some contraindications in the context of renal insufficiency. And one of the important things to remember as you use denosumab in myeloma is that one of the most common side effects is symptomatic hypocalcemia. So making sure that patients are getting calcium and vitamin D supplementation throughout their use of denosumab might be really important as well. And then again, other issues such as maintaining adequate hydration, avoidance of non-steroidal anti-inflammatory agents, avoidance of CT scan contrast would also be important, given that this is an older, frailer patient who doesn't have normal renal function.